Hello everyone, and thank you for joining my presentation today. My name is Jaden, and today we'll explore the complexities of social anxiety disorder, including its causes, misconceptions, and treatment options. What is social anxiety disorder? It is a mental health condition characterized by an intense fear of social situations. Individuals with this disorder often experience overwhelming anxiety and self-consciousness in everyday social interactions. To be diagnosed, a mental health professional will use the Diagnostic and Statistical Manual of Mental Health Disorder. There's certain criteria outlining what makes the diagnosis. The biggest factor is a persistent, intense fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. People with this disorder are particularly concerned with being viewed negatively, with being judged or being perceived as inadequate, embarrassing, or offensive by others. To alleviate this anxiety, they'll avoid social situations or endure these social situations with the anxiety, with the distress that they're in. The ultimate feature of being diagnosed would be it affecting and interfering with your daily life. So the duration persistence would be, longer than 6 months, and within that 6 months, it will interfere with your life. So it's more than just being afraid, being nervous to go and do your speech. It's impacting you to even complete the speech. The anxiety and stress and fear that someone with social anxiety disorder is experiencing. So what causes social anxiety disorder? It could be inherited. Genetically, it has been found to be run in families, such as suggesting a genetic predisposition, but however, it's not entirely clear how much of this may be due to genetics and how much is due to learned behavior. It could be your brain structure. The amygdala is part of the brain involved in processing emotions, particularly fear. So if you have an overactive amygdala, you may have a heightened fear response, contributing to increased anxiety in social interactions, or could be environmental influences. A traumatic event when you were younger involving an embarrassing social situation could develop or intensify social anxiety disorder. Additionally, it may be associated with parenting style. A parent who models anxious behavior in social situations, that could be passed on, imitation from the child. If my mom is modeling this anxious behavior in front of me in this situation, I will learn to be that way in that situation. Or it could be a controlling or protective parent. If they're controlling or protective, they aren't allowed to endure that situation on their own because the parent protects them from that. Next, we have common misconceptions. It's just shyness. It's not a serious condition, or it's easy to overcome. Overcoming social anxiety often requires professional treatment and ongoing support. It is a serious condition as it can have profound effects on an individual's personal and professional life. It could lead to them being isolated and that's a reduced quality of life. It's just shyness. While shyness is a component, social anxiety disorder involves severe and persistent anxiety that significantly impairs daily function, not just a little shyness. So moving on, we have our therapies options. First therapy option is cognitive behavioral therapy. This therapy focuses on identifying and challenging negative thought patterns and beliefs related to social situations. This will teach coping strategies such as relaxation techniques and exposure to therapy with medication, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors may be prescribed to reduce the anxiety symptoms. Group therapy, provides an environment for the individual to grow and learn from peers and to reduce their feelings, and it might help reduce their feelings of anxiety within social situations. And their self-help strategies, mindfulness, meditation, regular exercise, and stress management techniques can complement formal treatment and promote overall well-being. The effectiveness of these therapies, but research indicates that the CBT, cognitive behavioral treatment, is the most effective form of therapy for treating social anxiety disorder with long-lasting benefits. Medications may provide relief from the symptoms, but they're more effective when combined with therapy. And group therapy and self-help can be valuable additions, especially for individuals with milder symptoms or as ongoing support after completing formal therapy. And lastly, before we conclude, here are the references used in this presentation. Again, thank you all for watching my presentation, and have a good night.